Welcome to this video on gastrointestinal drugs. This guide is designed as a concise reference for pharmacy students and healthcare trainees, covering key drug classes, mechanisms, common agents, clinical uses, and essential safety highlights for your study notes. To understand these therapies, we look at their targets along the gastrointestinal tract. Drugs act at distinct sites, including the upper GI tract for acid secretion and motility, the small intestine for absorption, the colon, and systemic targets like the nausea center. Remember that this site of action guides clinical choice and potential adverse effects. We begin with acid-related therapies. Proton pump inhibitors, like omeprazole, work by irreversibly inhibiting the H+/K+ ATPase, offering strong acid suppression but with risks of long-term deficiencies. H2 receptor antagonists, such as famotidine, are less potent, block H2 receptors, and generally have fewer drug interactions, though tolerance can develop. Next are antacids and mucosal protectants. Antacids provide fast relief by neutralizing gastric acid. Sucralfate acts as a mucosal adhesive to protect ulcers. Misoprostol is a prostaglandin analog used for NSAID ulcer prophylaxis, but it is an abortifacient and is strictly contraindicated in pregnancy. Antiemetics include 5-HT3 antagonists like ondansetron for chemotherapy-related nausea, and dopamine antagonists like metoclopramide for gastroparesis. Watch for QT prolongation with 5-HT3 blockers, and extrapyramidal symptoms or tardive dyskinesia with dopamine antagonists. Cannabinoids and NK1 antagonists are reserved for refractory or specific chemotherapy-related cases. Prokinetics and motility agents enhance transit. Metoclopramide and domperidone are D2 blockers, while low-dose erythromycin acts as a modulin agonist. When using these, it is critical to use the lowest effective dose and monitor for both cardiac risks and neurologic side effects, such as tardive dyskinesia. For diarrhea and constipation, we look at antidiarrheals and laxatives. Loperamide is a mu-opioid receptor agonist that reduces gut motility. However, it requires caution in infectious diarrhea. Laxatives are chosen based on the patient's specific needs, ranging from bulk-forming and osmotic agents to stimulants and stool softeners. Management of inflammatory bowel disease involves a range of therapies. These include topical aminosalicylates, short-term corticosteroids for acute remission, immunomodulators like azathioprine for maintenance, and systemic biologics for moderate to severe disease. Always perform necessary infection screening before starting biologic therapies. Safety and monitoring are paramount. Be aware of drug interactions with pH-dependent agents, be mindful of special populations like the elderly or those who are pregnant, and ensure appropriate monitoring such as electrolyte checks, B12 and magnesium levels, ECGs for QT risk medications, and infection screenings. To summarize, focus your studies on the mechanism, agents, use, and safety of these core classes. For more educational content and visual summaries, follow the hashtag #NEPPharmacyTag on TikTok and Facebook. Save this video for quick revision before your clinical rounds.